Hello.
Hello, yes. This is Ellen Ray.
Hi. Thank you for
Hi.
joining.
Yeah.
I understand you're a certified midwife,
Certified
nurse
nurse midwife, yes.
practitioner.
Nurse
Okay.
midwife.
Is that the same as a nurse practitioner?
It is in the sense that it's an advanced practice nurse, but my specialty is in obstetrics.
Okay. What I was trying to just understand is how is the degree of a nurse midwife different from, say, a nurse practitioner or an RN?
It's advanced training beyond the RN level. It's a master's degree or a doctoral degree. I have a doctoral degree.
Oh, okay. Okay. That's helpful. So I had a couple questions for you regarding patient management and OB triage or, just in labor and delivery. And I understand you have both experience in both. So
Yes, I do.
And I was told like over 25 years, so that's great.
Yes.
Do you work at a hospital or in a birthing center, or where do you work?
Not currently. My position recently ended in the last few weeks, so I have not obtained another position. So, but I previously did.
In a hospital?
In a hospital setting, yes.
Okay. How big was the hospital? How busy was it?
The most current hospital where I worked was they did about 1,200 births a year. So not that big.
Wow. Okay. So about 100 a month?
Mhm.
Okay. And that's not busy. 100 births per month is not considered too busy.
Yeah, it's a smaller hospital in terms of in the area where I live. There's larger hospitals. Now, prior to this position, I worked OB triage at a much larger hospital that probably did 3,000 to 4,000 deliveries a year. So.
Okay. Wow. Okay. Is that the maximum that a hospital could potentially do, like 3,000 or 4,000 in the U.S.? Do you know? I'm just gathering information.
Yeah, I don't really know. I think there are larger hospitals and, that can do more.
Okay. Could you walk me through, some of the things you would do as a nurse, OB triage nurse or midwife nurse, when a patient came in to triage for either, during regular hours or during emergency hours? What is different and what would you typically do?
So most of the time, well, I'll just use the hospital where I most recently worked. So patients that were known to be pregnant and greater than 16 weeks pregnant, instead of going to the emergency room if they had an obstetrically related complaint, they would come to the labor and delivery department where we had our OB triage. So these patients did not have to go through the regular medical, emergency room. And so we managed their obstetrical concern that they were coming in for. So typically a regular registered nurse would take a little bit of the history of the complaint the patient was coming in with. Then she would tell the nurse midwife triage provider, and then I would go in and assess the patient and ask more questions and basically assess what problem she was. So, it could just be labor, the patient's in labor, and I evaluate whether or not she's in labor and whether she should be admitted to the hospital. Or she may be in with a complaint of decreased fetal movement or vaginal bleeding or something like that as well, and then I would manage those complaints.
So regardless of whether she was in impending labor or, whether the baby's movements were decreased or bleeding or whatever may be the complaint, what are the first things you did? Like, did you have to put her on a monitor right away, or did you have to check her blood pressure? I just kind of want every detail, if you could walk me through.